Hello, my name is Ariel Hadley and I will be talking about the relationship between race and health. Since 2020, the discourse surrounding the role racism plays in American society has become widespread. This has led many to analyze the ways in which racism is perpetuated in a variety of fields, from politics to education. Today I am discussing the two ways race impacts health, directly through interpersonal racial discrimination and indirectly through institutional and systemic racism. Interpersonal racial discrimination has a negative impact on the health of racially marginalized folks. Racial discrimination is characterized as a psychosocial stressor, which means that racial discrimination and exclusion provoke a stress response, leading to increased amounts of mood and anxiety disorders and increased chronic stress. Black people in the age groups of 18 to 34 and 35 to 49 were nearly twice as likely to die from heart disease, stroke, and diabetes as whites, with these findings being associated with weathering, where Black people experience premature aging and earlier health decline than whites due to the psychosocial, economic, and environmental stressors that accumulate across their lifespan. The stress of racial discrimination has also been found to impact the birth weight of Black American infants. In a study done by Dr. Collins and fellow researchers, they found that Black American mothers who delivered very low birth weight preterm infants were more likely to report experiencing interpersonal racial discrimination than Black American mothers who delivered non-low birth weight infants at term. This is especially dangerous because infant birth weight is a primary determinant of infant mortality risk. The 1% of births that occur at very low birth weight account for more than half of the neonatal death and 63% of the Black-white gap in infant mortality in the United States. Another way race impacts health is indirectly through institutional and systemic racism. One of the mechanisms that white supremacy uses to systemically marginalize race is through residential segregation. In the United States, the groups that are poorly connected to healthy environments, healthcare, and critical amenities and services tend to be disproportionately Black due to racialized zoning policies like redlining and continued architectural exclusion. A 2017 Harvard University study found that Black people are about 3 times more likely to die from exposure to airborne pollutants than others in the United States, and that racially marginalized people as a whole were exposed to more transportation-related pollution than white people. An example of this is found in none other than Paramore. Once a bustling Black middle-class neighborhood, Paramore has been destroyed physically and culturally by highway construction. The construction of I-4 and the 408 has encapsulated Griffin Park, a public housing project in Paramore, and an oval of pollution with many adults living in Griffin Park suffering from asthma and other respiratory problems as well. Black Americans being concentrated in areas of low opportunity and poor housing conditions has a strong impact on disease incidence as well. Dr. C and fellow researchers studied the extent to which socioeconomic factors explain racial disparities between Black and white people when it comes to incidence rates of invasive community-associated MRSA. The incidence rate of community-associated MRSA was found to be 7.6 per 100,000 Black persons versus 4.59 per 100,000 white persons. The researchers concluded that race itself was not a significant factor, but that socioeconomic factors such as overcrowding, low educational attainment, low-income housing, poverty, and being in a medically underserved area strongly contributed to this racial disparity. Similar patterns are seen with the recent COVID-19 pandemic. Dr. Ahmad and fellow researchers found that with each 5% increase in percent of households with poor housing conditions, there was a 50% higher risk of COVID-19 incidence and a 42% higher risk of COVID-19 mortality. They found overcrowding and lack of adequate plumbing and sanitation to be the most direct explanations for the higher incidence and mortality of COVID-19. Black Americans are more likely to experience these factors due to historical and societal experiences leading to the racial disparities seen today. It is impossible to create a sustainable world without centering racial justice and equity, especially when it comes to health. Human health is central to all sustainability efforts since issues surrounding housing and healthcare play a huge role in our physical and mental health. Any current sustainability advancements would be applied in an unjust and inequitable manner, leading to the most marginalized being the ones who suffer the most. This is why it is important to acknowledge the ways that race impacts sustainability. We have the power to incite change, for these conditions are not inevitable, and we should use that power for good. Special thanks to Dr. Chandler for being my Capstone mentor, as well as the SBE faculty for their continued guidance.